and if you would like to refer back to today's meeting, you may do so. Today, we'll just be giving a couple updates about what the Lung Association has going on, as well as some updates from all of our coalition members to hear about the great things everyone is doing in the communities and in their areas. And we will also be participating in some work group project discussions, passing along ideas about kind of what we can do in our work groups moving forward. And then, of course, we will have questions and closing remarks at the end. Okay. So let's get started. My name is David Huber. As most of you know, I'm a health promotion specialist with the American Lung Association. I work in the South Central region of Pennsylvania. And we'll have an opportunity to kind of introduce everyone when we do our coalition updates later on. As everyone should know, we received you should have received an email about a week or two ago about Day at the Capitol, which will be happening on May 3rd. Please be sure that you and your staff members and true participants register. Our registration will close Tuesday, April 12th. And you'll be able to use either the two links in this PowerPoint to register for the event. On the day of the event, you can expect virtual legislative visits to discuss MSA funding, like they do pretty much every year, as well as the clean indoor air. And these discussions will happen from 9 o'clock in the morning to 12 p.m. And then a community forum event will happen from 1 p.m. and 2 p.m. I'll also mention that after you register for the event, there will be kind of an advocate training on April 21st to help prepare for Day at the Capitol. And after this training, you'll receive materials such as your team's background and elevator speech and legislative tips, and infographics and fact sheets. So those are helpful tools to help you on that day. So it's important that you attend that advocacy training as well. Next slide, please. I don't think Lauren or Molly are not on, are they? No. Okay. Just didn't want to take up speak on their behalf. So and True are also getting involved, as you know. So the event will be similar to last year, but they're trying to plan to get more True groups involved in the legislative calls. If you do have, like I said, if you do have True groups that are interested, please make sure that they register. Hopefully they'll try to get them more involved in the legislative calls and in discussion. But the virtual community forum is also an opportunity for the youth to hear more about what MSA funding is and important lung health issues. And as it has been mentioned, it's been challenging for students to get out of the classroom for the virtual event. The PAC team and True have been planning ways for youth to get involved on their own time as well. Youth are also encouraged to advocate through social media and complete, True activities. And there will be a contest among all True groups as well. I think the goal that they mentioned for this year is to get 200 True youth and 90 PAC adult advocates to attend this year. And if, so again, please register if you haven't already, and, get all your True groups and staff registered as well. And if you have anyone that has questions or would like to know more about Day at the Capitol or True, they can go to the PAC website or go to trueandpa.org Day at the Capitol 2022. Okay. So the American Lung Association has also been working on a Freedom from Smoking testimonial video. So this Freedom from Smoking testimony video idea came from a service provider who thought it would be a great idea to have a marketing tool to use when discussing the Freedom from Smoking program to participants who may be interested in joining. People that are smoking or vaping and may want to quit, but are kind of intimidated or hesitant to attend the first class. So this would be a great tool to use to give people an idea of what that process is like, what the Freedom from Smoking class is like, and kind of ease those anxieties of the first day or just taking the first step of joining the Freedom from Smoking program. So we created, we're having this Freedom from Smoking testimonial video created, should be done this month, but we wanted to show you a little clip here of kind of a rough draft that was created by our Fahlgren production and media team. We also have a coalition one being made as well, but we would just show you this Freedom from Smoking one. This one was Melanie Duchess, who is from the South Central region, and she was so kindly volunteered and was able to participate in this testimonial. So I don't know.
David, I'm going to go ahead and try to share it.
Okay.
Hopefully the audio works. I'll just share a brief snippet of it. So if you could just let me know if you guys are able to hear it on your end, or if it will let me click on it. All right, maybe not. I knew I should have opened it up in another window. Let me see if I can do that really quick. For you. Sorry, guys. Of course, we have to have at least one hiccup.
At least one.
For this virtual offering. I know we are all counting down the days where we can all go back into in-person events. So let me see. All right. I was able to find it. Are you able to see this screen now, David?
Yes.
Okay. Well, it's 2 minutes and 20 seconds. So this is, as David mentioned, a very rough clip. They are editing this, but wanted to be able to just share a little bit of, as David mentioned, some of what Melanie was able to provide to us and talk about her experience with Freedom from Smoking. So if you could let me know, David, if the volume works once I press play.
20-something years. I didn't think it was a habit. I didn't think it was impacting anybody else. I just thought it was impacting me. But really, it was affecting everyone else around me. And I don't want it to affect my son because that's my baby. I want my baby to have a clear message. Hi, my name is Melanie Duchess. This is my son, Christian. This is how I found Freedom from Smoking. I didn't know that I was going to end up quitting. I pictured that I was going to smoke the rest of my life and live like my dad. But I wish my dad was here to see the progress that I made. I really do. I miss him. But I stopped the cycle of smoking cigarettes and dying from COPD.
I mean, I don't want to lose another person that matters in my life, truthfully.
I wasn't ready for it, but I went into it anyways, and I realized I was smoking less and less each time. Did I have to quit on day one? No. I just had to prepare myself mentally, what it would look like. It's one day at a time, sometimes 1 second at a time. It's not easy, not that easy, but you will if you really put your effort into it.
The program did help her, and it did, it made her a better person as well. It made her think, more about it. And I was kind of like the extra push to get her to completely quit. Proud of my mom. She's gone through a lot. in her life, and I'm just proud to see her stop smoking. I'm proud to be the reason why she stopped smoking. I'm also proud that, the feeling of enjoyment and everything that she has finally stopped.
Reach out.
Awesome. Thank you, Chelsea. Yeah, yeah, working on this testimony shoot has been really great, and can't thank Melanie and the Fog Ring team enough. I mean, during the shoot, I mean, Melanie and her son were just amazing, and giving, their testimony was just it was really moving. There was a lot of parts that weren't able to make the video, but it seemed like every time she spoke or anything she said was really heartfelt, and everyone in the room was just kind of blown away by things that she was saying. And so we're excited to share these tools with you and these videos, and like I said, hopefully they'll be done by the end of the month, and we'll be happy to share those resources with you, everyone. So we do have some coalition communication and media updates regarding our website and social media pages. And to discuss those things will be our colleague Amber, who's also a health promotion specialist with American Lung Association. So I'll pass it on to Amber, who will kind of give you some updates on the exciting things we're doing with our social media and website. Amber.
Hi, good morning, everyone. I'm Amber. So as David was saying, we do have a lot of things going on for social media. I've been really excited with everything that's been growing. We have been able to increase the amount of people who are actually coming to our page and visiting the coalition page to see the resources that we're offering. We've also been able to engage more with you guys, our partners, and following your pages and making sure that we're sharing information about what's going on. Right now, we are preparing for some upcoming events like the Day at the Capitol and all that, and starting to put information out there to tell people, how they can participate, and also resources on, how to interact with the local legislators and whatnot. We currently have Instagram page. We also have Facebook page, and we now have a Twitter account that's being, that is being used as far as sharing our information. What we would like for everybody to do is make sure you're following us, so that way we can follow you back and we can get information out there. We can share everything that you guys are doing. That's wonderful. We can share everything that we're doing, as well as if you guys ever have any testimonies or anything that you want to share about anything dealing with the Tobacco Free Coalition. I apologize. So pretty much that's what we are doing. If anybody has specific questions, or David and Chelsea, if there's something that you specifically wanted me to touch on, just let me know and I can do that.
Yeah, thanks, Amber. No, just you pretty much hit everything on the nail. I will just reiterate, like I've told many of you, please feel free to share the great things and events that you guys have going on in your areas. Even if you don't have events, just any new updates or exciting things that you're excited about that you're working on to share with us, so we can add those to our newsletter or social media pages, so we can share those with our ALA team and share it with other coalition members as well, because I'm sure other people would be interested in hearing about those things as well. But thank you, Amber.
David, I can also review the resources in the newsletter if you'd like.
Okay, yeah, sure, Julie. Thanks.
Okay, so we are very excited because we are updating our website with new resources, not only new resources, but to make it easier to search for what you are looking for. We know it has been a little bit complicated because it's all on the same page. We have decided as a team to separate out all of our resources. Our new categories would be just a page for advocacy, cessation, prevention, and additional resources and special initiatives will be on its separate pages. And then the more important stuff might be repeated on each page, just so you will know. We also will have a sidebar, so that way it'll be easier to navigate within the pages. Just all tools to make it easier to search for what you're looking for. If you have any suggestions, please go ahead and email me. If you say, hey, I can't find this, and every time I go to it, I can't search it, and it's been over a minute. We want to make sure you guys can find what you're looking for within a minute. Go ahead and send it to me, and we'll go ahead and update the website as needed. So that is that with the resources. We are excited to make those changes for you. As far as the Coalition newsletter, I am excited to report that we successfully moved it to the beginning to midweek of the month. So basically in the middle of the month, the newsletter usually goes out. In the beginning of the month, I do ask for newsletter articles, and I am pleased to report that you guys have been doing a fantastic job with sending me your articles. Please keep it up. That is a big plus for me, so thank you so much. Again, expect your regional coalition RCPTFC newsletter in the middle of the week. If you have any articles, updates, events that you would like to portray in the newsletter, you don't have to even wait for me to ask. Go ahead and send it to me, and I will save it for that newsletter or the very next newsletter. It does help. And the other thing we do with the newsletters is we save it on our website, so that way you can go ahead and review it at a later date to find out events or things that you have missed or you couldn't find your copy. All right, so go ahead and keep them coming, and I really appreciate you all for sending them to me. Thank you.
Thanks, Julie, and thanks for the great work you do on the website and newsletter, and thank you, Amber, for all the great work you do with the Facebook page. And I will say, I get a lot of questions about, questions regarding materials or information on different programs, sensation programs, or who are providers in different regions. And I would say more often than not, you'll find all this information on our website under the resources tab. And quit now. Just take a deep dive in that website. There's a lot of great stuff on there. And if you can't find something on that website, then feel free to ask, please. But like I said, more often than not, you'll probably find everything you need on the Coalition website. We do have some enforcement updates. We know we have an enforcement inspector opening, a couple of positions opening for an enforcement inspector. Derek, did you want to talk about this, or?
Yeah, I can real quick just cover our needs currently. Hi, everyone. As many of you know, the American Lung Association conducts compliance checks at all tobacco retailers in the South Central region, which is part of our tobacco enforcement program. There's over 1,800 tobacco retailers across our 13 counties in this region, and at least one compliance check must be made at each location within each fiscal year. So in order to meet this requirement, we're currently looking to add an individual to the enforcement team. We're looking for a part-time independent contractor to work as a tobacco enforcement inspector in this region, specifically in the Dauphin, Lebanon, York, and Cumberland area in those counties. For qualifications, a bachelor's degree and experience in law enforcement and public health is preferred. We'll be including the entire job description for the position in the minutes today after today's meeting. So feel free to share this open position with your contacts and with anyone who might be interested in this position and working in these areas. In addition to filling the inspector position, underage buyers will be needed to help assist our inspectors. Inspectors may recruit their own underage buyers in addition to promoting the job opening if necessary. We'll also be including the full job description for the underage participants in the minutes. So if you can, please feel free to pass along this information to your contacts, as well as True Group members who may be interested. All interested candidates can email me directly with their resume and cover letters. My contact information is listed in the job description. So if you have any questions, please don't hesitate to reach out. Thank you for your time.
Thanks, Derek. So we also have a disparities toolkit available on our coalition page as well. I know we've mentioned this a couple of times before. But we're continuing to look for ways to distribute this toolkit out to our communities. This toolkit is a great tool. Talks about a lot of different things, including data and prevalence regarding the different populations. Each population has its own kind of standalone section in the packet that goes into basically why it matters, what we need to know, what works for certain populations, data, prevalence, and different resources that target these specific populations. And again, this is available on our coalition website under the diverse populations tab. Chelsea, did you have anything to add about the toolkit?
Yeah, thanks, David. Yeah, just to add, I would just say this is a resource that we were working on for a while in 2020, and now it's available. It was a very large document, and as David mentioned, when focusing programming to various target populations, there's things that needs to be adapted. So a lot of these resources are just this toolkit is really compiling what's been done and what's been successful in different parts of the state, as well as it does reference information outside of the state and what other states are doing. So we would love for you guys to check out this part of our page. Really goes into a lot of detailed information, and there are PDFs available that you can download directly from our website as well to utilize when you're doing your work in the community. But if there's also anything that's missing that you guys are doing and you guys are working on within tobacco control with a certain population, please let us know. We want to make sure we can update this website and these documents in real time. But we do have on the next slide, as David mentioned, there's each page has its own each priority population has its own page and a corresponding PDF. So you can kind of see here a list of the various priority populations that we mentioned and populations that are disparately impacted by tobacco. So thanks to a lot of you. There's a lot of great information in here on work that you guys have been doing in these areas. So anybody who shared information with us, we really appreciate it. And again, if there's anything that's missing, please let us know. We want to be able to update this document and really have great resources that you guys can utilize to reach various populations within your counties and with your communities. So thanks, David.
Thanks, Chelsea. So at the beginning of this year, American Lung Association was awarded a COVID-19 vaccine outreach grant from the Pennsylvania Department of Economic and Community Development, which is really exciting. Basically what this grant does is it basically looks to support local efforts of local organizations in Pennsylvania to conduct kind of grassroots outreach to communities about COVID-19 vaccines. And what the American Lung Association plans on doing is, supporting our local communities and organizations to educate kind of the rural areas who have been disproportionately affected by COVID-19 due to low vaccination rates, and improve the use of vaccines in these communities, improve vaccine confidence, dispel misinformation, and just overall improve the health and safety of Pennsylvania and individuals in these areas. So we're in the planning phase right now of this grant project, but the American Lung Association plans on using the grant money through kind of a vaccine ambassador framework to, train individuals, community leaders that will then go out into communities and train and educate other community members throughout Pennsylvania about COVID-19, about vaccines. And, this will be done through webinar trainings and educational tools, motivational interviewing, and just providing the community with tools about how to address and engage in these difficult vaccine conversations. So, if you're interested about learning more about the COVID-19 vaccine outreach grants, or think that you have organizations that you are partnered with, or know that any organizations in your community that you think would be a good fit for becoming vaccine ambassadors, please reach out to me, and we can get the conversations going. And certainly after this meeting, we'll be sending more information about this in the email and the follow-up email. All right, now it's time for coalition member updates. So we would love to hear about all the great things that all of you are doing in your communities, whether it be new work site policies or just any great updates that you guys have and great things you guys have going on. So just share your name and organization that you work with, your role, and what you have going on. We'd love to hear it. So I'll open the floor, and I'll pick on Pastor.
And David, I'll actually say that I can, if we want to stop sharing the screen and everyone wants to take their self off camera, and if they're comfortable, we would love to make this feel more like a networking opportunity that we normally have during our coalition meetings. I know that's something we've really missed, is just being able to do a round robin with everybody. And here, I know this is something we usually do at the beginning, but we thought it'd be a great way to break up our meeting of just being able to go around, hear from you guys. I know there's some new individuals that have joined our coalition since we last met in person. But yeah, as David mentioned, want to do a round robin. We want to hear from you guys. What are you doing in the field that you want to share with your colleagues? So David, I'm not sure if you picked on somebody, but I think you went in and out. So if you wanted to call somebody out, or if someone wants to volunteer to get us started, that would be awesome.
Well, I don't like picking on people. I just said I would open the floor. If I had to pick on someone, I will, but hopefully I don't have to.
I'll go. Right. So my name is Karen Rush, and I work at the First Center. We actually are doing a huge project with the Department of Corrections. And so we're going by telephone into multiple SCIs throughout the state, and we're working with inmates in smoking cessation. So right now, I've probably started in November, so probably about 100, 125 people in different stages of the program and cessation. So that's where I'm spending a lot of my time, and I'm seeing a lot of success, so it's going pretty well.
Okay, that's awesome. Thank you. Thank you so much for sharing. Did anyone have any questions about that? And that's a great thing to work on. No? Okay.
I'll share. My name's Leah. I work with WellSpan Health as a health educator, and I coordinate the tobacco programs in York and Adams counties. I just wanted to share with you all, you will see it in the coalition newsletter coming up, that Tobacco Free York County is hosting a virtual vaping webinar on April 7th from 7 to 8 p.m. It'll be held over Zoom. I can put the link in the chat if you're interested in registering. The idea is that it's for anyone that works with youth and wants to learn more about vaping and vaping devices and how to kind of work with youth in prevention. So yeah, that'll be coming up here in a month.
Thanks, Leah. Yeah, please do share. Love to have everyone register for that. Yeah, and thank you for all the great work you're doing in York and Adams County. Really appreciate the work you're doing. Also, I will say, over the last couple of months, me and Leah have been working together to get community gardens in York City to go tobacco-free. And through our collaboration, we've been able to get the American Lung Association to create tobacco-free, specific community garden tobacco-free signs, specifically for community gardens. And honestly, we've seen a lot of interest for these signs through our partners and in the community. So I will also share those in the follow-up email. But just wanted to let everyone know about that and share that with you.
And I will just echo what David said. That's been a great partnership and collaboration. And I know YLAP, Young Lungs at Play, is a great program that a lot of you work on and have been working on for years. So this is kind of a spin-off of Young Lungs at Play and doesn't count as exactly. I know there's a lot of reporting and different things. If you are a tobacco provider with us, there's a lot of reporting that goes along with YLAP and only specific areas count. But this is something that's still really important and really great tobacco-free policy. So as David mentioned, we can include that in the meeting minutes, a picture of what those look like. And if anyone's interested or talking to community gardens or anyone who would like signage for that, we'd love to be able to provide that for you as well. It's a metal sign that looks just like similar to the YLAP signs that we have.
I'll go ahead and share. This is Holly. I'm with Lebanon Family Health. First of all, I love that garden idea, so thanks for sharing that. I guess some of our big initiatives we've had going this year is we started our first True Plus group, which was college True groups. And they've done some really great work doing interactive displays that we're hoping to have travel the county into some of the middle schools and high schools as part of our vaping awareness effort. So they've done a really great job. And then speaking of vaping, we really took off this year with the ADEPT program. In the past 6 months, we've worked in a coalition with our Community Health Council within Lebanon County, a number of partners working together to try to make some headway in terms of the youth vaping awareness. And so our in-depth program has become institutionalized now into 3 of our 6 districts. So we're really excited about that. And we're hoping to utilize that to build the NOT program. So that's our next step that we're working on with that.
Awesome, Holly. Thanks for sharing. And I'm just curious, because I don't think a lot of people, I think the True Plus is kind of a new concept and not a lot of people know about that. But to what capacity do the True Plus students kind of work? Do they go back into high schools and try to recruit high schoolers to join True? How have you been working with college students in that aspect?
It's still a work in progress. Our first stage of it was they created a community-wide display. It was a really great display. We actually have it posted on our Facebook page that was interactive and open to the community to come visit. And so our next step is we're trying now to make it a traveling display to go to the different high schools. So that's stage 2. So we're working on that right now. But it's about 6 to 8 active college students. And with the initial goals, they will all, do outreach into area middle schools and high schools. That's the idea. Yeah.
Awesome. Thank you.
Okay. You're welcome.
I can go next, kind of following what Holly was talking about.
Yeah, go ahead, Eric.
All right. There we go. Hello, everybody. I'm Eric Rothwell from the Harrisburg Area YMCA Center for Healthy Living. And Amy, please feel free to jump in here if you want to mention anything also. Going off of what Holly said, yeah, it's been the same with us this year, especially within the in-depth program. We've been hit probably harder than ever with court referrals and school district referrals to the program. I think between the 2 of us, we are 5 or 6 different school districts in our service area with the in-depth program, and it just keeps going. Right when we think we're going to finish up a group, we get more referrals and we just get started again with another 4-session program. Same thing with what Holly said too. Hopefully we can use it kind of as a filter system for for those that actually want to make that quit attempt. Couple other updates from us. We are kind of wrapping up our health equity tour that we've been doing statewide, but it is going to be continuing. And so we may be reaching out to you again and inviting you to join us when we come into your areas on our health equity tour. And we will also be, we're working on a new initiative that's just in the early stages of a tour doing vaccine education to homeless populations in congregate living facilities across the state. We may be reaching out to some of you too when we come into those different areas serving the homeless population. And that's mainly for education about vaccines and then also testing. Those are two things that just kind of updates I want to report. Amy, do you have anything to add? Maybe Amy's not here. But Dave, I would like to see you do that little dance again too. That was nice. There we go.
No problem, Eric. Thank you so much. Appreciate you.
This
And
is
for those
Sherry
that are
Stair
having-
from the Lung Disease Foundation. I can go next if you like.
Hi, Sherry. Yes, sure.
Thanks. We too have been really busy with in-depth. We've struggled a little bit with freedom from smoking, although we do have a new class starting tonight that has about 6 or 7 people in it. But since the beginning of the year, we've continuously had an in-depth class. I'm on my 3rd one, and I think I've averaged somewhere between 4 and 6 or 7 people in each class. And like Eric said, I am not even done with one, and then I start getting calls for another one. So our Altoona Area High School, as well as our GACTC here in Altoona and our local magistrate have been referring a lot of youth to us. So I really think too, I'm amazed that it really is eye-opening at the fact that they don't know anything about these devices when they come in here. They're really shocked at how dangerous they are and the risks involved and so forth. So I think that is a good program, and we're going to try to expand that with other districts in our county.
Thanks for sharing, Sherry. Yeah, it seems like everyone is seeing an uptick in in-depth referrals. This makes us think kind of what are the contributing factors for this. You know, I'm sure there's multiple, but did the pandemic really exacerbate the situation?
Yeah, and I've seen that the youth surveys are showing that the numbers are down, but that's hard to believe based on the number of people that were getting referred for in-depth. I don't know if anybody has any input on that or not.
I don't think we have any extra input, but we here at the ALA agree. We've had discussions with other schools that have like a very high number of individuals who are vaping. So
I will say there's also, new tech that's being put in schools, vape detectors in bathrooms. So while it might not necessarily be more kids smoke using vapes, there are new ways that, school resource officers and teachers are monitoring the situation. So you probably will see an uptick in in-depth referrals, just as more of those devices are implemented in schools. Yeah, that's from the conversations we've had that we've noticed, and there's a lot of push among some of the organizations we've seen for those devices.
This is Julie. I also think that more teachers are aware of it now, so they're looking out for it, because I get a lot of requests for classes for in-depth and not in certain areas all over the United States. So I see that the teachers are now reaching out to us, administrators, principals are now reaching out to us saying, okay, we need this now. So it has been more in the forefront.
Maybe I'll jump in real quick just to say hello. This is Meredith from the Lung Association. I feel like it's a good time for me to jump in because in-depth and working with the schools is something I've been having a lot of interest in. And I just wanted to share that I've learned that different school districts have different, requirements for the hoops they have to jump through to get these programs started. And I'm learning that it's very different depending on the school. So one school district recently had to have the programs approved by the board, and they did get it through. That had to do with the stipend and the funding, the mini grant funds. But another school district just told me last week that they have so much funding because of extra COVID money that they don't even need the mini grant, and they don't have to bring anything before the board. So it can be real different from district to district, and just to keep that in mind as you're having these conversations, because I kind of assumed that it would all be a very standard process that they had to go through, and it's not at all. So it's interesting, but there's definitely a lot of interest here in North Central Pennsylvania, which is the area that I'm serving. That's all I really have.
This is Sherry again. We've had some luck too, securing grants from other agencies locally. We got one from Ronald McDonald House Charities, and we got one from the UPMC Altoona has its own foundation, so that we could fund between them and our foundation, not using American Lung Association grant dollars, but we've actually provided 2 school districts, Hollidaysburg and Altoona, which are the 2 largest ones in Blair County, with the vaping sensors at their request. So there's certain things they have to do. If we fund the sensors themselves, they have to do the pay for the updated software. They have to pay for the installation, which Altoona High School is a brand new school, so it wasn't a huge problem to install them there. But Hollidaysburg was a little older, so I think they had to incur some additional funds to install them. But there are other options out there if people, are asking for help with the sensors to secure funding. And I do think they are helping, and I do think that's another way that we're getting a lot of referrals for the in-depth program. And I also think that the local rules are different too with regard to how that's handled. I know Hollidaysburg and Altoona both have ordinances so that the cases can be then forwarded to the district magistrates, and then they're referring to us. So I think that varies from county to county or municipality to municipality as well.
Hi everyone, this is Shelly. I'm just gonna jump in quick. Totally off topic of what everyone else is talking about, but I'm just gonna give a little plug, a little asthma plug. It's first off, it's great to see a lot of familiar faces and names here. I don't get to talk to everyone very often anymore. But again, my name's Shelly Cree. I'm with the American Lung Association. I work more in the asthma side of things, but I already put it in the chat, so it's a little further up if you want to take a look there. But we do have scholarship opportunities in Pennsylvania for Open Airways for Schools and Kickin' Asthma facilitators. So they are both school-based or community-based programs. So they do asthma self-management. Open Airways for Schools really targets the ages 8 to 11, and then Kickin' Asthma is the next step in that. So it's like 12 to 17 age range. So if you need to learn more, again, you can check those links that I put in the chat, or you can email me. But if you have any questions, feel free to reach out. That's all I have. Thanks.
Thanks, Shelly.
And I did want to apologize to anyone who is having trouble getting themselves off of mute and their camera on. I did go back through, and everyone's camera and mute button should be disabled or enabled. So you should be able to take yourself off. And I apologize if you're still experiencing trouble, but feel free to message me in the chat. Just wanted to mention that as we continue, but go ahead.
I can go next. My name is Tamara Raymer. I'm a Community Impact Director with the American Heart Association. I do cover 17 different counties and growing in Pennsylvania, but some of those market territories are Lancaster, Lebanon, Lehigh Valley and Berks, the Capital Region, so looking at, you know, all around Harrisburg and York area, and also Erie. So I do a lot of work around tobacco and vaping, around like the policy system and environmental change level. One of the efforts that I do focus on at the policy level is tobacco-free schools. So we're really looking at updating the policies, you know, if necessary, but more or less fine-tuning the codes of conduct, because we want to see with a first offense, we want to see that they're getting, you know, that education and cessation that they need. So, you know, we're all talking about in depth, catch my breath, the NOT program. You know, we want that to be the first offense versus being fined or going through suspension. We also do, at more of a systems change level, working with healthcare systems and clinics to include tobacco cessation reminders in their electronic health records if they aren't already doing so, but then also making sure that they are, you know, referring folks to cessation services if they are saying that they're using traditional tobacco products or e-cigarettes, you know, or both. So that's just some of the work that we're doing at the American Heart Association.
Thanks, Tamara. Yeah, it's great to hear American Heart Association also having a say in tobacco work as well. And I've been saying, you know, I don't know why American Lung and American Heart Association don't collaborate more on these efforts, you know, but
it would be very nice, yes, and we certainly can. I love collaboration.
Right.
So.
But thank you.
Yep.
Does anyone else have any updates that they would like to share?
I guess I could go. My name is Shannon Mason from UPMC Central PA. My colleagues are also on the call, one of which is Pam and Adam. And for those of you that are new members in the group, we do tobacco cessation support in the community, corporately, in our outpatient sites. However, I don't want to steal all the thunder because Adam so diligently got his camera and mic queued up. So I'll just cover a couple and I'll let him fill in the blanks of anything that I've, you know, might have missed. But we actually have been working on a quick kit dissemination within the system, for which we kind of compiled all of our resources generously donated by the American Lung Association. And we added a couple little tidbits also, but we found that it would be very beneficial for some of our outpatient offices and inpatient support staff also to have some quick kits on hand, because not every person who is dialogued with about their tobacco use actually want to be referred to us, but we don't want them to not have some of those tools. So we figured those frontline folks that actually have that point of contact, it would be beneficial. So in departments like our lung cancer screening department, our pulmonary care support, specifically with our COPD and lung nodule clinics, our oncology sites, our cardiac sites. So we were able, well, we're still in the process of dissemination, but at least giving them a sample of items that they could utilize that we thought would be generous, because we so generously received it. So we wanted to share those resources with our system as well. In addition to that, we have our annual Children's Health Fair that's coming up. It's always the first Thursday in May. And one of those stations that's being offered is always our lung station, our lung health station. So my colleagues and I are actually collaborating to support that as well. I think this is the 45th year of that, and the target population is third or fourth graders. They're ready and eager, and they love to see our pig lungs, of course. So those are two initiatives that I will share, and I'm actually going to, I guess I'll even tag in. We have some support offerings that, support group offerings that are still virtual, that are very vibrant and still rolling very well. Given our current state of events, we're actually also able to slowly get back out into the community to do some education tables, and provide some support to our corporate partnerships as well. And Pam, I'll let you even drop some comments in the chat if there's anything that I forgot, but I'll do a hot handoff to Adam at this time so he can pick up from here.
Thank you, Shannon. It's good to see everybody. I'm Adam Bennett from UPMC in Hanover. To kind of build on what Shannon was talking about, we've seen some changes in the past couple of years as far as how people are utilizing individual and group cessation counseling per se. And with those changes and kind of going into more of in our experience, a demand for shorter, more brief types of interventions with people, we've really been working within our system and with our partners in the community to try to streamline how we can deliver the type of help that we offer and do so well in different types of settings. So that means collaborating with physicians' offices, getting out and networking with them, since hospital systems tend to be growing right now, making sure that they're aware of what we have accessible and available, both through our program and also to larger things like the Quit Line, for example. And, in the case where you have somebody who's seeing a specialist at one facility or within one healthcare system, also making sure that they're aware that we can connect them with something that's a little bit closer to home for them. So, while we might not be doing the same types of counseling that those of us who've been doing this a while are so accustomed to, we've been trying to take advantage of the opportunity to learn how to just better connect people with the type of help that they want, where they can get it, and when they're ready for it. And on top of that, getting out and doing more types of community events. I can speak for myself in the sense that in Adams County, working with a school district there to really create a more comprehensive way of educating their students, starting at the middle school level and up through high school. So we have a coordinated approach to primarily doing vaping education at this point. But we talk about tobacco like we always have done, but also building on with vaping and just making it part of their curriculum in a sense. And that's been a long process. And, for those in this meeting who have ever worked in Adams County, that there's been a lot of work that's been done there over time. And it's just kind of nurturing that along and trying to see where we can go and just really adapt to what types of support people in our communities want. So I think that's about it.
Awesome. Thanks, Adam. Thanks, Shannon, for sharing all the great work you guys are doing. I see Jen's here. Hi, Jen. Good to see you. Anyone else have any updates that they would like to share?
Hey, Dave, can I give a quick plug for something?
Of course, Eric. Yeah, go ahead.
Okay. Let me turn my just really quick, I forgot to I wanted to give a quick plug for something. The Pennsylvania Health Equity Summit is April 6th and 7th. I definitely recommend, if you have the chance to attend, it's worth your while, and it's in person or virtual. You can choose the way you want to do it. It's definitely a good use of your time. I've been there before to the summit, and it's really great. So if you're able to, I definitely recommend it.
Thanks, Eric. Yeah, and we will definitely share the save the date with everyone here. For those that are interested in attending or registering for the conference, we'll share that information with you after the meeting. Okay, well, if no one else has any other updates, I think we can move forward with our work group discussions. So we'll break out into different work groups and just kind of, join discussions about different topics that we would like to consider working on as a work group. We have a couple listed here. And of course, if anyone else has other ideas or different things that they think would be useful tools to work on and provide their communities, please mention those and we can discuss about those also during the work group. So I think Chelsea has the power to
Yes. I have the power to
move
break us up into two different groups. So as David mentioned, I know that our work groups this past year have been really difficult to engage. I know that there has been one work group, and I know that Julie's been a part of, and you guys have done some really great work on creating some social media posts, which we're working on finalizing that can be utilized for individuals that are vaping, that are kind of that young adult age range, since we have a lot of resources and marketing towards the younger population, but kind of more the adult. So I know that that work group has still been going strong, but we really want to hear from you guys about what we can do to better our work groups, and really want to have this time with breaking out into two groups. We have some suggested topics, but we know that what we've heard from you guys from our coalition back in November is that when the work groups, we have a prevention advocacy and a prevention policy and cessation work group. When those work groups are really working towards a shared mission, goal, and project, that you guys are able to create something, that's the best use of all of our time. So we really want to use this time today. We know it's getting towards the end of the fiscal year and things are crazy, but really want to start planning for next year, and as we return back to in-person coalition meetings, how we can further have a plan for next year of what we can focus on and what you guys are interested in creating as a coalition. So I'm going to go ahead and break you up. You are randomized into two groups. So David will be leading one discussion, and these are kind of the main pieces here. I'll try to put them in the chat box for us as well. And then Mike Glantz, who's also on from the Lung Association, will be leading the other work group in discussion. So this will be a time we want to be able to hear from you guys, share what you think, what you see as a need in your community, and what we can kind of assist. All of us can come together, our great minds, to create something. So bear with me, this didn't work last time we had a coalition meeting, so I'm really hoping it works this time. So I'm going to go ahead and open these breakouts. Everyone should start to move into a room, and we'll come back. I'll give you time while we're coming back.
We do.
Hello, sorry. Go ahead and share our screen.
Just real quick, sorry, Adam, you got cut off there, but I agree with everything you were saying. And we'll definitely collaborate more.
Thank you guys for bearing with us during our technical difficulties, and I'm realizing everybody's mic and camera is disabled again, so I will work on allowing that, and I'm sorry for anyone who was unable to participate in the chat. Definitely have some research to do about this moving forward, why that might have been the case.
Yeah, so just to give a little report about what we were talking about in our work group. Someone had mentioned that there are trainings out there for oral health providers regarding referring their patients to tobacco cessation. And so I think, this was one of the things that was talked about during our breakout discussion, as well as either updating or creating materials for oral health providers and dentist office, because a lot of people, stopped going to the dentist during the pandemic, and now they're seeing a lot of people going back to the dentist, and the dentist office are allowing, to have materials back in their office. So, this was something that people showed interest in, as well as someone had mentioned, having a regional youth conference, similar to one that was done in the past. And yeah, that was pretty much it.
And I'll give a little report back for our group. We talked a lot about starting to facilitate relationships with faith-based communities, particularly in the capital region. Adam brought up that Shannon, just to give you a little shout out, you have been developing a lot of relationships in that field, and I think that is something we can develop toolkits and get our names, into those communities, as Adam brought up, and really start to reach those communities, offer new avenues for cessation resources. And that's something that we can also extend beyond the South Central region, particularly in a lot of our more rural communities, South Central, North Central, Northeast, where faith-based organizations are some of the uniting factors when people are so geographically spread out. So we had some good conversations around that, and hopefully we'll be able to expand upon it in the coming weeks.
Awesome. Was there another breakout group?
There was just two.
Oh, you're just two? Okay.
Yep.
Okay. Yeah. So I mean, I think that we can definitely decide kind of what avenue we want to go to. If there's any other suggestions or ideas, please let us know. I think there's a question in the survey that regarding work group projects. So please fill that out, and provide us with your ideas. But that's the end of our meeting today. Does anyone have any questions about the material that was discussed today? No, okay. If not, like I said, please don't forget to take the evaluation survey. This is very important to us because it allows us to see what you guys think of these meetings. Allows us to see where we need to improve. And so, like I said, there's questions about the work groups, so it allows us to see, how we can move forward and improve the work groups, and provide move in a direction where we can create something that's tangible and work on a project that we can use in our communities, that we would see a need for. So please fill out these surveys. They're really important. And our next coalition meeting will be in June. And time and date we'll provide you at a later time. So please be on the lookout for that. Okay. But other than that, that's all I have. Please, like I said, please take the survey, and we'll send out a follow-up email with all the resources and things that we talked about throughout the meeting. And if you have any questions or anything, please don't hesitate to reach out to me or anybody on the ALA team. We'll be happy to assist you in any way that we can. All right. Well, with that, I bid you guys a farewell and a great rest of your Tuesday. And we'll be talking to you soon. Thanks, everyone.
Bye, everybody.
Thank you. Bye.
Bye.
Goodbye, everyone.